Okay. So, um, the first thing that we have to know is that it is the voice box. Okay. And what does that mean? As I said, it is used to create voices, like different pitches, high or low. And as we know, it exists in the anterior part of the neck. Okay. Exists in the anterior part of the neck. Okay. Um, where does the larynx take us to? If you enter through here, you will go into the lungs. Hence, it is part of the respiratory system, okay? Or the tract that takes the air to the respiratory system or to the lungs, okay? Um, so the structure, let's speak about the structure. It is made up of cartilage. This is not bone. Like this is not equal to this. This is cartilage. This is bone, okay? And this cartilageous structure is held by different ligaments. And as you can see, you have cricothyroid and thyrohyoid, okay? And they are held together to create the larynx. And so ligaments help to connect those different cartilageous structures. Um, internally, like let's say I do this, okay? I'm gonna try my best to, let me see if we can see the internal muscles. You can see that it has also muscles on the internal side. And we are required to know all of those things inside the larynx, just so that we know and understand exactly uh, the function of each, okay? Um, and so you will see that it has two functions um, that are guided by those muscles. And so these muscles are used first of all, and as I said, this is the larynx. Uh, you see those vestibular folds? These are the folds that are controlled by these muscles. And these muscles are required to create this function called the phonation. What does phonation mean? It is basically the production of voice. And you will have two vocal cords that are present here that are either um, pulled on or relaxed. Once they're pulled on, you create a higher pitched. Once they're relaxed, you create a lower pitched. And these muscles are the muscles that contract or release those vocal cords. The second thing is breathing. Of course, it's part of the air tract, and so hence helps in breathing. We will look at the whole structure of it, the location, the whole structure, how it is made up of blood vessels and innervation. And so that will maybe be sufficient. And so the first thing we know, it's located between the, it's located in the anterior compartment, okay? And it's located between C3, okay? Sorry, C3 right here, and C6 right there. So that's the region where this larynx exists. And it continues after the larynx, you will have the trachea. This part right here is the trachea. So larynx is this structure, okay? And this structure ends or leads to the trachea, okay? Um, now, let me see if I can hide this and show you something. You can see that, maybe I can hide this part. Yes, this is the pharynx, right? So look, let's say we are walking through the nose or through the mouth. The first thing that you enter is if it's through the nose, the nasopharynx. Okay, you breathe in air. The air goes into the nasopharynx, enters the oropharynx behind the mouth, then enters the laryngopharynx, which is the part of the pharynx that is in close relation or contact with the pharynx. Um, if if sorry, let me hide this and hide this. If the air, if it's air, right? So the air would take the route going to the lungs like this. But if it's food, something called the epiglottis would cover this part, the laryngeal inlet. The laryngeal inlet will be covered by epiglottis to allow the food to enter into the esophagus or the food pipe. If the epiglottis does not close this in time, or uh, something happened, you're eating so fast, or you're breathing and eating, you will choke. Because let's say you're breathing and you're eating at the same time, food will the air will take some of the food inside here. Why is because when air is breathed in, it tells the body that the epiglottis does not need to cover that space. And imagine there's food in your mouth. So now you're breathing, and air causes epiglottis to be opened, and it takes some of the food in. So now the food also takes that route, and uh, gets trapped in this area, and you start to cough. That's why you have this choking reflex. You start to cough, and if it's really dangerous, it blocks that area within the vocal cords that I will show you in a bit, and then you really need help. Someone needs to press on your stomach to push air out of your lungs to cause that piece of food to go out, go up this way. Okay, so the windpipe and the food pipe are in very close relations, and the thing that splits their function, air or food, is the epiglottis. Okay, now um, what is just externally, without going first into structures? I know I'm going to take some time doing this one, but let's reset and see. This is the larynx. If we increase muscles externally, it is covered by the infrahyoid muscles, and you can see the ones that we learned. Infrahyoid, you have sternothyroid. Let's get the other one. Sternohyoid, thyrohyoid, and these are infrahyoid muscles, the muscles that lie within below the hyoid muscle. Okay, um, and laterally, you can see. Let's say remove the muscles laterally. We can see that the thyroid gland um, surrounds the larynx. Okay. Um, what else do we have here? If we see, yes, you have. Where's the arteries? Um, the larynx is also very closely related with major blood vessels of the neck. Okay, like the internal jugular vein, the common carotid artery. These lie laterally to the larynx. Okay, just general information. And so this gives us the space to say where the location of the larynx is. Okay, anterior compartment lies, um, the thyroid gland lies around it. Muscles such as the infrahyoid muscles surround it. Um, the esophagus is is located posterior to the larynx, um, and um, this is so important clinically, as I said, um, um, because of the air movement of the air and the food. Okay. What's the larynx made up of anatomically? Okay. First, we have the cartilageous structure. Okay, cartilageous structure. and I will just dive into it quick. It's very interesting. Um, these cartilage structures are held by ligaments and membranes. Okay. Um, the outer uh, structure first, we have cricoid cartilage and the thyroid cartilage. The cricoid cartilage and the thyroid cartilage, the thyroid cartilage is superior and the cricoid cartilage is found inferior. What connects the thyroid cartilage to the cricoid cartilage? We know cricothyroid ligament, the lateral part, and you have the median part, or the median cricothyroid ligament. What connects the thyroid cartilage to the hyoid bone is the thyrohyoid membrane. Okay, these are the external structures. Now, if there is external structures, we also have internal structures. Okay, internal structures. Gonna hide all of those. And this here is laryngopharynx. This is not the larynx. I'm gonna hide it. So that's the naked larynx. Okay. Of course, there's still cartilage inside, and these make up further stuff. And internally, you can see that arytenoid cartilage, left and right, exists. Okay, that's the third type of cartilage that is present. Fourth, we have the corniculate cartilage that exists on the top of the arytenoid cartilages, right and left. Okay, and also we have this thing called the conus elasticus, left and right as well. Okay, left and right. Let's hide those cartilages and get out the tissues, the soft tissues. I hope in this we can see the vocal cords. Maybe these are the ones. Yes. See, vocal ligaments. This is the larynx. Okay. This is the epiglottis. Okay. 1 second. Okay. Now, so first, internally, or the internal cavity of the larynx is divided into three sections. First, the supraglottis. Okay. Supraglottis, the glottis, and the subglottis. Okay. Now, the supraglottis is from the inferior surface of the epiglottis, okay, to the vestibular folds here. This is the supraglottis from the inferior surface of the epiglottis to the vestibular folds. This is the supraglottis, okay? The glottis, the glottis contains the vocal cords here. This part right here is the glottis. It contains the vocal cords. And the opening between the vocal cords is called the rima glottis. And that's what I was going to tell you about. I can't maybe I can make a slice here. Let's see. Maybe I can make a slice. I'm not sure. Yes, it doesn't work. So if I cut this part, if I cut this part like that, okay, from here, and these are the vocal ligaments, if I cut it and I look at it, if I cut it like this and I take this slice out and I look at it, between those two bones, there is an opening, a very small opening called the rima glottidis, okay? Uh, where it is the small opening that is the size of it is controlled by those two folds. Once, and those two folds, let's get the muscles out. See, those two folds are is controlled by muscle action, such as the vocalis here, or even the thyroarytenoid. Okay, and these muscles, if they contract and relax, what do they do? What they do is they uh, increase the tension in this cord. If they contract, they would increase the tension. Increasing the tension means that the vocal cords are pulled on. Imagine you have a rope, and this rope, if you pull on it, or like two people pull on it, the rope will have tension. If they get closer to each other and holding the rope will be like left hanging. This means less tension. Okay, so that's what I mean. These muscles, imagine the muscles, they are like two people pulling on this rope in a tug war, and that rope has so much tension. It's not just hanging on the floor. This is how it looks. And so if these are pulled, like one here, and then one here, they will have so much tension, and that rima glotitis will be smaller in area, and this causes it to help the person to create a high pitched voice. On the other hand, if the muscles relax, they will reduce tension, increase the surface area of rima glotitis, which is the hole between those two cords, causing a high pitched voice. Okay? Any questions about this so far?
No.
Okay. The next area about after the glottis is the subglottis, which is from the inferior border of the glottis, okay, to the inferior border of the cricoid cartilage. And this means that I'm referring to here. I'm gonna hide this. So the subglottis is from here. Sorry, this is the vocal cord, but this is the inferior border of the glottis. From the inferior border of the glottis to the inferior border of the cricoid cartilage. Okay, from here to here. Now, now, um, let's see. I'm gonna want to go back here. Yeah. What supplies? So now that we know the structure of the larynx, what supplies the larynx with blood? What supplies the larynx with blood? Two things: the superior laryngeal artery and the inferior laryngeal artery. So, where do we see those, and what part of what vessel does the superior laryngeal artery come off? This is the superior laryngeal. The superior laryngeal artery is a branch of here, the superior thyroid artery. So the superior thyroid artery would give a branch called the superior laryngeal to supply the superior part of the larynx. The superior thyroid artery is an artery springing from the external carotid artery. Okay. The next thing is the inferior laryngeal, and I think it is this one. Yes. The inferior laryngeal artery is a branch of the inferior thyroid artery. So you have superior thyroid coming from the external carotid artery, giving rise to the superior thyroid artery. And you have the inferior thyroid artery, which is a branch of the inferior thyroid artery, laryngeal, coming out of the inferior thyroid, and the inferior thyroid comes off of a different artery, which is the thyrocervical trunk coming off the subclavian artery. Okay, and so we don't need to know all of those branches, but you will learn this anyways when you are learning the external and the internal carotid, or the veins in the future. But what we need to know, vasculature of the larynx is from the superior laryngeal and the inferior laryngeal, coming off from the superior thyroid and the inferior thyroid arteries. Okay, now innervations. The innervation of the larynx, okay, it receives both motor and sensory innervation from the vagus nerve, from the vagus nerve. Now, um, the the vagus nerve gives off a branch called recurrent laryngeal nerve. Recurrent laryngeal nerve. The recurrent laryngeal nerve is used to provide sensory innervation to the infraglottis. Okay, again, you have here the infraglottis, as you remember, internal structure that is below the glottis, which was below the borders of the cords. Right here, the infraglottis, hopefully I can, maybe it's this. Yes, this is the external branch of the superior. Um, Maybe this one as well. Yes, that's the one. Okay, I found one of them. So this branch is called the superior laryngeal nerve, but what I was talking about is the recurrent laryngeal nerve. The recurrent laryngeal nerve provides sensory innervation to the infraglottis and motor innervation to all the internal muscles of the larynx. Again, it provides the recurrent laryngeal nerve provides sensory innervation to the infraglottis and it provides motor innervation to all the internal muscles of the larynx. So let's say you got hot food touching the internal surface of this, the temperature of that hot food. Oh shit, what am I saying? Um, let's say hot air comes inside here because larynx is part of the respiratory tract, not the food. Larynx here, hot air comes in, touches the surface of this. You feel that it's hot air because of your recurrent laryngeal nerve providing sensory information, senses the hot air, senses the temperature of this air, sends it to your brain, and tells you the air you're breathing is hot. And this is due to the vagus nerve, the branch recurrent laryngeal nerve. And if you want to sing in a low pitch or a high pitch voice, you would need your vagus nerve to cause motor innervation to let those muscles contract, increasing the tension in the vocal cords, causing you to have a high pitch voice due to the decreased surface area or like the decreased circumference of rima glottis, which is the circle that lines between those two chords that I explained, and you will have a high or low pitch voice. Again, recurrent laryngeal, sensory innervation to the infraglottis, and allows the contraction of those muscles. Okay? The next one, superior laryngeal nerve. Um, Superior laryngeal, superior laryngeal. I'm gonna decrease the muscles. I'm gonna remove the nerves. I'm gonna hide this. The superior laryngeal, as we said, or the structure that we discussed before, I'm gonna remove the pharynx. The supraglottis, remember, was from here, the inferior part of the epiglottis, to the specific structure was, yes, the vestibular folds. Yes, here, or the vocal cords. So the supraglottis was this area, and the superior laryngeal nerve, what does it do? It provides sensory innervation to the supraglottis, and the external branch of this superior laryngeal nerve provides motor innervation to the cricothyroid muscle. There's a cricothyroid muscle. Cricothyroid. Where is it? Give me a second. The cricothyroid. Ah, no, it's not here. This one. So cricothyroid muscle, this muscle is innervated by the superior laryngeal nerve. Okay. And that's the innervation for the larynx. Again, vagus nerve splits or gives rise to recurrent laryngeal nerve and superior laryngeal nerve. The recurrent laryngeal nerve would um, would give sensory information to the infraglottis behind those cartilages here. There's the part of the larynx called infraglottis, provides sensory information to test the temperature of the air, for example, and provides motor innervation to all internal muscles that exist behind the cartilages in the larynx. The second nerve that comes out of the vagus is the superior laryngeal nerve, provides innervation sensory to the supraglottis and the motor innervation to the cricothyroid muscle right here. Okay? And that is the general information about the larynx. Okay. The next thing we have to discuss, I've touched upon them, but they're the cartilages. Okay? You know them now, but it's good to come back to it. I'm going to remove some muscles. Remove this. The cartilages, first, thyroid cartilage. The thyroid cartilage, and if you see on males' necks, sometimes, it's referred to, the Adam's apple. Adam's apple is due to this part. It is very prominent in some males. The cricoid, the thyroid cartilage is responsible for the Adam's apple prominence in the throat of many males. Okay. This prominence is called laryngeal prominence or Adam's apple. Okay. What else? The thyroid cartilage is made up of two sheets, one and two, the right and left, and they are joined in the front to form this laryngeal prominence. Okay. Then posteriorly, let's just isolate. I don't know if we can. Yes, we don't. We can do it, but posteriorly, both sheets, they give the superior and the inferior horns. The superior horn is connected to what? Superior horn is connected to what? To the hyoid bone by the lateral the thyrohyoid ligament here. See? The superior horn is connected to the hyoid bone by the lateral thyrohyoid ligament. Okay? The inferior horns are connected to, or they articulate with, the cricoid cartilage. Deal? Okay. Now, the next one we're going to talk about is the cricoid cartilage. Cricoid cartilage is basically a ring. If I isolate it, it is basically a ring. And this ring is made up of hyaline cartilage, and it is much narrower anteriorly. So you can see posteriorly it is um, very, very wide, and anteriorly it's narrow. And that's the structure of this ring. Um, and what is unique about it is that it completely encirculates the airway. So air, of course, larynx passes through here. It completely encirculates this. Now, what is unique as well is I'm going to select another thing. Maybe let's do a multiple selection right there, because it's so important how we know the articulations of those cartilages together. See, it articulates with the paired arytenoid cartilages posteriorly, and it provides an attachment of the inferior horns of the thyroid cartilage. Here, see this part here, you can see this is where the inferior horns of the thyroid cartilage attaches, and I can select it. How can I do it? But you get the idea. It was here, and you could see that the superior horns attached to the hyoid bone by the lateral ligament, and then the inferior one attached here. So that's what they're trying to say. Okay. Um, the next thing, so we knew now, thyroid, cricoid, arytenoid, corniculate. The next thing is the epiglottis. Here, let's reset everything. Let's take the epiglottis out alone. Where'd it go? Oh, no. Here. Isolate. This is the epiglottis. And the epiglottis, it's like a leaf-shaped plate of elastic cartilage. This is an elastic cartilage. It marks the entrance of the larynx, and so if it shuts, it will shut the laryngeal inlet, as I said. Um, where is it attached? I'll show you. Look, let's do multiple selection. It is attached to the back of the anterior aspect of the thyroid cartilage. There's a stalk here that extends, which causes it to be attached here. During swallowing, it will flatten and it will move posteriorly to close off the ring, to close off the larynx. Okay, let's show you how this happens. So I'm gonna hide this. Imagine, see, this is the stalk that I was talking about actually. Wait, let's see if I can isolate. Here, see? Um, wait, let's deselect this. Never mind. But look, you can see that the stalk that I was talking about is right here, causes it to be attached to the larynx. Now, let's say, so this is the laryngeal inlet. Okay, let's select it with it. I hope I can select it. Yes, there we go. Select this as well. Isolate. Now, let's say, now you can see that the epiglottis just lies on the supraglottis, lies on the supraglottis. And let's say it flattens. What happens is it will move this way. If it moves this way, this opening closes. So now food is pushed through this one here. It doesn't go in here, but it goes in here to the food pipe. That's the function of the epiglottis. Now, remember one more thing. This view is very good. Remember when I told you the rima glottis? This is the rima glottis right here. The rima glottis is the opening or the slit between the two vocal cords. And the vocal cords, let's say you pull here and pull here and pull here and pull here, they will have tension. This tension will cause this slit to be narrow, causing you to release a lot of voice that is high pitched. Let's say you relax them, this slit will be larger, causing high pitched. Okay? And that's the general idea. So all what we talked about currently is three: thyroid, cricoid, epiglottis. These are unpaired. The paired one reminded me. Okay, so now as we said, first we finished the pairs. The ones that are left to talk about, fuck, the unpaired. The one we're gonna talk about are the paired, and the two ones that I showed a little bit ago was the arytenoid here plus corniculates, and I'm gonna select them. Okay, and these ones are the first two that we're gonna see for the paired, and you can see there's a close relation between the arytenoid and the muscles, and the arytenoid has a very good use to pull on the vocal cords. So look, see what I mean? So look, arytenoid and the vocal cords are here. If muscles pull on the arytenoid cartilage, they will cause the vocal cords to be having tension or less tension. See? So you have a muscle here that is called the thyroarytenoid, which pulls or controls the arytenoid, and the arytenoid is connected to the soft tissue of the larynx, and this movements cause tension in the vocal cords. Okay, this is why these cartilages are so important. Okay, the last pair that we're going to talk about, it's present in a very difficult place. Not here, sorry, I wanted to hide it. See here, this structure right here is called the epiglottic fold. Isolate. Epiglottic fold. And the epiglottic fold contains the last paired cartilage called the cuneiform cartilage. Um, they are present inside the structure here in this region to strengthen the aryepiglottic fold. This is the aryepiglottic fold, and the cartilages here inside of it are called cuneiform cartilages, and they are used to strengthen the arytenoid cartilage, the aryepiglottic fold. Sorry. Okay. Now, let's just go back. I want to mention a couple of things about the arytenoid cartilage right here. You can see, um, if we go back, you can see that the apex, it articulates with the corniculate cartilage here. The apex articulates with corniculate cartilage. That's the apex of the arytenoid cartilage. The base articulates with the superior border of the cricoid cartilage. The base articulates with the superior border of the cricoid cartilage. The vocal processes here, this is the vocal process that goes in here. So you have apex, base, vocal process. Provides attachment for the vocal ligaments. Okay. And muscular process, it provides attachments for the posterior and lateral cricoarytenoid muscles. So cricoarytenoid, if we get it out here, cricoarytenoid, yes, 1 second. Crico, where is it? Cricoarytenoid. Yes, that's the one. Isolate. The cricoarytenoid, which is the muscular process attached to the muscular process. I'm going to select the other one as well to show you. No, not this one. Where is it? Yes, here. Isolate. You can see how it connects to it. That's the apex, that's the base, that's the muscular process, and that's the vocal process. And you have the cricoarytenoid muscle. Okay. So parts of the arytenoid cartilage. There's the arytenoid cartilage, parts of it: apex, base, vocal process, muscular process, and what they're attached to, the apex to the uh, corniculate cartilage, the base articulates with the superior border of the cricoid cartilage, the vocal process attaches or articulates with the what do you call it? The vocal cords, and the muscular process attaches to the crico arytenoid muscles. Okay. Um, we have finished the cartilage of the larynx. Okay. The next part we're gonna discuss. Next part we're gonna discuss is about. Give me a second. I want to remove this one. I don't know what's okay. Um, there. I hate Zoom, man. Okay, so let's go back. I'll say it very, very quickly. And I think I know what I was doing. So arytenoid cartilage isolates. The arytenoid cartilage is made up of four parts. First, you have apex, muscular, vocal, and base. Apex, muscular process, vocal process, base. What does the apex process articulate with? The corniculate cartilage, which is here. It's a small one. What does the um, uh, vocal process articulate with? The vocal ligaments. What does the base articulate with? The superior part of the cricoid cartilage. What does the muscular process articulate with? It articulates with the cricoarytenoid muscles. Okay. Now, this cartilage has a very important role, is that um, muscles attach to it and cause the vocal cords to be what is it called? Vocal cords to be um, increase in tension or decrease in tension. And this is why it is a very important structure. Like if you have muscles in C, they surround it. And I don't know if you're with Wozniak or I don't know who, but Wozniak, who was my professor, he explained it in a very shitty way in the first time. I didn't really get what he was saying, but when I studied it, he was he was trying to hint on the structure of this cartilage with his fingers. So he created some sort of Spider-Man hand gesture to tell me that this is the process, that's the process, that's the process, and the way it moved and how the muscles connected it. I don't know if you're with Wozniak, you would understand what I'm trying to tell you, but if not, forget about it. But the muscles here, when they contract and they relax, they move this cartilage, and this cartilage is very in close relations with what the vocal ligaments, and help us to create different pitches. Okay, um, that's the paired and the unpaired cartilages of the larynx. Okay, deal. That's good. The next one we're gonna discuss maybe the laryngeal muscles. Okay, the muscles that I was always referring to and we didn't discuss. Now I know there's a lot of things to discuss in the larynx, but it's good that we can do it all in one sitting so that we're done with it. And I hope you're just writing notes with me, and hopefully, like I'm recording so that you can come back to it, because it's a lot. It's really a lot. But I personally like it because once you get over it and you cover all the details, you will find that it is not a hard structure at all and it's very easy. Okay, now we go to the muscles. First off, you have extrinsic and intrinsic muscles. Okay, they're divided into extrinsic and intrinsic muscles. The external, so just general information about the external or the intrinsic muscles, what they do is they elevate or depress the larynx during swallowing. They elevate or depress the larynx during swallowing. In contrast, what does the internal do? The internal, like we discussed, they move individual parts of the larynx. Like for example here, like this one is an internal. It moves the arytenoid cartilage. Okay, so the external, what it does, it elevates or depresses the larynx as a whole. The internal muscles are smaller ones and they're attached to very specific other things. What they do is they move specific structures inside, not just everything. The internal one plays a very important role in breathing and phonation. Okay, so in external, it helps in swallowing, but internal helps in phonation and breathing. Now, the extrinsic. Let's start with the extrinsic muscles. The extrinsic muscles act to move the larynx superiorly and inferiorly. Okay, act to move the larynx superiorly and inferiorly. And they are made up of what? The suprahyoid and the infrahyoid groups. So remember when you learned about the suprahyoid and the infrahyoid groups, these muscles, they cause or they were used in swallowing, right? And so if they're used in swallowing, you would see or notice that when someone swallows, their whole structure or the Adam's apple is moving up and down. So yes, they are muscles for swallowing, but they're also muscles that are in close relation to the larynx and cause the larynx to move up and down. Hence, we call them extrinsic muscles um, that act to move on the larynx superiorly and inferiorly. So if this contracts, for example, moves the hyoid bone up, what's attached? Again, larynx moves up, right? So infrahyoid and suprahyoid muscles, they are used or called the extrinsic muscles of the larynx as well. Okay. Um, what else do we need to know? What are they, right? We need to know what are they. And I think it's a different point to discuss, but we don't need to go into details right now. But from your knowledge right now, I think you know infrahyoid and suprahyoid muscles. If not, it's okay. But the suprahyoid are mylohyoid, stylohyoid, digastric, and geniohyoid. These are the suprahyoid muscles that cause or elevate the larynx. The infrahyoid muscles, we know them as well, close relations with the larynx, omohyoid, sternohyoid, thyrohyoid, sternothyroid. Again, omohyoid, sternohyoid, thyrohyoid, and sternothyroid. Okay? Now, the intrinsic muscles are the things that you don't know, which is what we need to discuss. So the intrinsic muscles, the ones that we saw here, I'm gonna take them out bit by bit. So let's just increase it a little bit here. And this is an extrinsic, we don't need it. Extrinsic, we don't need it. This is what I'm talking about. First, you have the cricothyroid. Let's see. There we go. Cricothyroid, what does it mean? It goes from the cricoid cartilage to the thyroid cartilage. Okay. Mm, let's see. Cricothyroid. So the cricothyroid, okay, what it does, um, it stretches or tenses the vocal ligaments. Okay. This muscle is also in relation with what the vocal ligaments. Here, vocal ligaments. They have a very important structure in also stretching and tensing the vocal ligaments. So they have function in what voice, and they have a name called singer's muscle. This is called singer's muscle. Okay, the attachment, it originates from the anterolateral aspect of the cricoid cartilage and attaches to inferior margin and inferior horn of thyroid cartilage. Let me try and select. Man, I hate this platism. Here. All right, so here, boom, 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 isolate. Look. The cricothyroid is made up of straight part, oblique part, okay? And it's called Singer's muscle and it affects the vocal cords directly. Originates from anterolateral aspect of cricoid cartilage, inserts into the inferior margin and inferior horn of thyroid cartilage. Deal? Action stretches and tenses the vocal ligament. What's it innervated by? External laryngeal nerve. Again, from cricoid to thyroid, stretches and tenses the vocal ligament. External laryngeal nerve innervates the motor action of this muscle. Cricothyroid. And so you might be wondering, like, what the fuck these muscles have to do with the vocal ligaments if the vocal ligaments are found in the tissue? But look, if they contract, what are those? Look, see this what I don't know, I can't select them. Yeah, here. Vocal ligaments. So imagine if this contracts, it will move this whole cartilage in front. Causes what? Those to have tense, to be tense. Causes this rima glottidis, which is the slit between them, to become smaller. Creates what? A higher pitch. If they relax, they relax, they, sorry, if they contract, yes, become shorter. Yes, that's a very good question. Just give me a second. Yeah, I remember there was a confused part here. Now my brain clicks. 1 second. 1 second, 1 second. Just want to make sure. Quick cool. Yes. For relaxing them. Okay, so if they contract, let's say they contract, they become short. Okay. Yes, if they contract, they will move those forwards. Exactly. They will tense them. The cricothyroid is responsible for tensing the vocal cords, hence creating high pitch. Now, just put a note before we get into them. The thyroarytenoid and the vocalis are responsible for relaxing them. The cricothyroid tenses them. The thyroarytenoid and the vocalis are responsible for relaxing them. Deal? And I'll show you. If this contracts, gets the thyroid cartilage in front, gets the vocal cords in front and tensed, and cause the rima glottis to be smaller. If it's smaller, it's a smaller slit, hence air whistles, and so you have lower pitch of voice. Okay? Deal. Hope that makes sense. Now, the next muscle is, let's hide this. The next muscle is the thyroarytenoid. The thyroarytenoid. Let's see if I can get this out and isolate them for you. Right. Thyroarytenoid. Maybe this one. No, that's this transverse arytenoid. Oblique arytenoid. Yes, here. Yes, let's select them. 1, 2, 3. Isolate. Look. This is the thyroarytenoid. Now watch. Wow, I love this actually. Trying to also get the vocal cords in here. See if I can. Maybe I can't. Maybe let's select the larynx in. Let's see. All right, fuck it, no problem. Okay, so now look. The muscles here are required to relax the vocal ligament, allowing for a like more softer voice or like deeper voice. It attaches to or originates from the infero-posterior aspect of the here, infero-posterior aspect of the angle here, the angle of the thyroid cartilage, or let's just say from the from the inner surface of the thyroid cartilage, okay, and attaches to the anterolateral part of the arytenoid cartilage. Anterolateral part of the arytenoid cartilage. Actions, it relaxes the vocal ligaments. Okay, guys, imagine this contracts. Okay, imagine this contracts. It will shorten, right? This will become closer to this, or this will become closer to this. What's in between? The vocal ligament or the vocal cord. If this becomes closer to this, or this becomes closer to this, the vocal ligament becomes relaxed. It will become like, imagine Nastia and Marina, okay? And imagine there's a rope between them, okay? Nastia is pulling this way, Marina is pulling this way. They will be tensed, okay? But imagine Haytham comes and holds Nastia and then goes to get her close to Marina. The rope between Nastia and Marina becomes what? Relaxed. This causes the rheumatoglottis to become wider and gives you a better voice. See what I mean? That's what I mean. That's the function of the thyroarytenoid muscle. If it contracts, that's Haytham getting close Nastia to Marina. The vocal cord between them becomes relaxed, and you have a higher pitched voice, a lower pitched voice, relaxed voice. Innervation, it's innervated by the inferior laryngeal nerve. Inferior laryngeal nerve. Okay, now you have a muscle called cricoarytenoid. And this muscle is divided into three parts. And this is maybe where you might be confused. We did, I hope I can get it out. We did so far those two muscles. We did cricothyroid, thyroarytenoid, and then you have those ones. Look, the transverse and it's the transverse, yes, that's transverse. Where is it? Oh, that's the oblique. That's the transverse. Maybe this one, I'm not sure. Ah, that's posterior. 1 second. Is there left? Ah, that's the lateral maybe.
I'm sorry, where is anterior cricoarytenoid muscles located? Because I couldn't find it.
Sorry, what's the question?
Where do anterior cricoarytenoid muscles located?
Uh,
Locate, I mean.
the anterior, sorry, wait.
Because we have posterior cricoarytenoid muscles, and logically we have to have anterior.
Yes, 1 second. That's a very good question. Um, ah, uh, 1 second. That's a good question, but I know, mm, I think it's more of, let me show you. It's more of, that's the anterior. It's like the lateral cricoarytenoid. It's not like, um, wait, I'll show you what I mean. Like, look, so the muscles that are left are those, and the posterior. Wait, where's the posterior? That's the posterior, right? Yes, the
Mm-hmm.
posterior, right? And there is no anterior, but there's lateral here.
Mm-hmm.
That's the one. So
Uh-huh, okay.
posterior and lateral. Okay,
Mm-hmm.
that's for
Thank
the
you.
that's for the logical part. Now, look, we finished what, girls? We finished one, and we finished two here. Okay, and then we have those left. So First, we have the posterior cricoarytenoid. Posterior cricoarytenoid. The posterior cricoarytenoid muscle, uh, they are abductors of the vocal cords. And what does abductors mean? Abductors mean that they are literally the only ones that are literally able to cause the rhemoglottis to increase laterally. Like, what do I mean? Imagine like the only muscle that is allowed to open up the rhemoglottis. You have two vocal cords, okay? Like let's say, wait, maybe I can do it like this. Wait. This muscle, okay, imagine the vocal cords are like this, okay? From here to here, and you have this like this, okay? Or you know what? Let's make it short, like narrower. Oh, come on. Okay, here, like this and like this, okay? For example, this muscle is the only one that is able to pull the vocal cords laterally and widen the rhemoglottis in here. See what I mean? Or not quite. Like this, these are the vocal cords. The vocal cords, they're either tense, like very straight, or here, like there's like tense. Okay, that's when they're tense. And maybe when they're relaxed, they're like this. Okay. But what we are talking about right here is that they are not tensed or relaxed, but they are widened. Let's say like this. This space becomes bigger because of this muscle. That's the whole idea. Easy? Hope it's easy. Um, so what I'm trying to say, the posterior cricoarytenoid is the only muscle that is able to abduct the vocal cords away from each other. Abduct is just abduction away from each other, okay? This muscle originates from the posterior surface of the cricoid cartilage. It's here because the cricoid cartilage is the ring that lies here. It originates from the posterior surface of it. Maybe I can select it. Please, it's this one, please, please. Yes. See what I mean? There we go. It originates from the posterior surface of the cricoid cartilage and inserts into the muscular process of the arytenoid cartilage. Remember the muscular process that we discussed, which is here, of the arytenoid cartilage, which is this one. That's where the posterior cricoarytenoid cartilage muscle attaches. And innervated by inferior laryngeal nerve. Okay. The next one is the lateral cricoarytenoid cartilage. The lateral cricoarytenoid. The lateral cricoarytenoid, which is this. The lateral cricoarytenoid is the major adductor of the vocal cords. They narrow the rhemoglottis. Adductor means supposed to get them closer to each other, even closer. Okay? It's the major adductor of the vocal cords, and it originates from the arc of the cricoid cartilage, and attaches to the muscular process of arytenoid cartilage. The arc of the cricoid cartilage and attaches to the muscular process of the arytenoid cartilage. Actions, it adducts the vocal cord, as I said, and innervation, inferior laryngeal nerve. Same, inferior laryngeal nerve. What's left here? Transverse and oblique. This is the oblique and transverse. The transverse and the oblique arytenoids, these are the last muscles we're going to discuss. They adduct the arytenoid cartilages. They adduct the arytenoid cartilages. If this contracts, they will cause the arytenoid cartilage to come together. If they contract, they cause the arytenoid cartilage to come together. What does this also do? It majorly causes the posterior portion of rhemaglotis to, to become narrow. Look, the rhemaglotis is like a slit, right? We said it's a slit that lies between the two vocal cords. And if these muscles contract, they will cause the arytenoid cartilage to move this way, move this way. And we said that the vocal cords are attached to the arytenoid cartilages. And so if the arytenoid cartilages are closer together, this space, the rhemaglotis, becomes smaller. It narrows this space. So action, adduction of arytenoid cartilages, innervation by also inferior laryngeal nerve. And the attachments, how do they attach? They attach from one arytenoid cartilage to the other. That's it. Spans from one arytenoid cartilage to the opposite one. That's the attachment. And these are the muscles, the intrinsic muscles of the larynx. We have one last part for the larynx, which is we touched upon them, you and I, but we didn't discuss specifically their stuff, like the ligaments and the folds inside of it. We did not do those yet. So far, we have discussed the muscles, extrinsic, intrinsic. We have discussed the parts of the larynx, supraglottis, glottis, infraglottis. We have thus discussed the cartilages. We have discussed the inferior, the intrinsic muscles. And finally, we have the folds, ligaments, and membranes. Okay. So I know it's very intense what we did today, but it's good that we have finished it. It's just the last part. Okay. Now, um, okay, so membranes and ligaments, okay. Why are they used? They are used to support the cartilageous skeleton of the larynx. Like the larynx is made up of cartilage. Membranes and ligaments are used to support the skeleton. First, you have extrinsic ligaments. Okay, extrinsic ligaments, we know it. Extrinsic ligaments. We have thyrohyoid membrane, median. Sorry, median. Yes, this is the median. But then you have also the lateral parts. It's divided into median and lateral. Then we have the hyoepiglottic ligament. Connects the hyoid bone to the anterior aspect of the epiglottis. And this is something I showed you before, which is this. I hope it's this one. Here, thyroepiglottic ligament connects the thyroid cartilage to the epiglottis. That's the second thing you have to know. The third is cricotracheal. Cricotracheal ligament. We didn't do this, but that's the one. Cricotracheal connects the trachea to the cricoid cartilage. And finally, we have the median cricothyroid ligament. Of course, also has a lateral part. Okay. The intrinsic ligaments, you have the cricothyroid ligament, cricothyroid ligament. Ah. Wait, this one, we can't hide the other one, you said. So there's a ligament. How can I show this? I think it's this one, but I'm not sure. Just give me a second. Oh, okay. That's what they're trying to say. Okay, I got it. Okay. Here you have the median cricothyroid ligament, okay? But then intrinsic, they consider this as an intrinsic. It's called the cricothyroid ligament, originates from the cricoid cartilage and extends superiorly where it terminates with a free end in the upper margin, like this. Okay, that's the cricoid ligament. And then you have something called the quadrangular membrane. I really don't know how I can show you this, but it's there. So it's extrinsic, we know them. Thyroid membrane, hyoepiglottic ligament, cricotracheal ligament, median cricothyroid ligament. Intrinsic, you have the cricothyroid ligament and the quadrangular membrane. Okay. Now the folds, what are the folds? The folds now. First, you have the vocal folds. The vocal folds. Um, okay. They are structured like the vocal folds are structured in many different ways, and there are four ways that they are structured like histologically. You have vocal muscles. Sorry, the vocalis muscle. Okay, you have a vocalis muscle. I think maybe it's where is it? Vocalis muscle. Not here. Here. First, you have the vocalis muscle, and when we talk about vocal folds, they are folds um, like when I say vocal folds, I'm meaning true vocal cords, okay? And um, they are under control of muscles for phonation, for example, voice, okay? And those vocal cords are controlled by muscles for the functions such as phonation. And how they are controlled or what type of movements they are producing, abduction, adduction, relaxation, or tension to control the pitch, okay? Um, and on the other hand, you have vestibular folds. And the vestibular folds are those. Okay, so you have focal ligaments and vestibular ligaments. The vestibular folds are the false vocal cords. These ones are the true vocal cords, and these one are the false vocal cords. They lie superiorly to the vocal cords, and they contain or have the vestibular ligaments. Okay. They are covered by mucous membrane and are pink in color. Okay. And these are the two folds that are present. Okay. You have to remember that for the vocal fold, it is made up of, if you want histology, non-keratinized stratified squamous epithelium. This one is made up of non-keratinized stratified squamous epithelium. Okay. Um, it has vocal ligaments. It has surrounding it the vocalis muscle and something called the between them, between those two, is the rima glottitis, which is the space where the voice is controlled due to that uh, um, size of the rima glottitis. Okay, and always true folds, false folds, or true vocal cords or false vocal cords, and we talked about them. I think this is the end of the larynx, and I apologize, I've hurt your brain, but now hopefully you got like a first exposure for the larynx. Um, my advice is to arrange all of those things in a very well-formed speech. Like if you get the larynx and you know it really well, I think you're one of the luckiest. I know it's like a very tough thing to know, but there's so much to study about the larynx. You don't need to stress when you have it, especially when you know all of it. I took one of the points that I had on my exam was larynx, and I had a very good speech prepared for it. I started with the general structure of the larynx, and then I talked about the cartilages, and then I talked about the laryngeal ligaments and folds, and finally the muscles. And I mentioned almost everything. Um, like you would go from the soft tissue, speaking about the supraglottis, infraglottis, and the glottis itself, the borders of it, where it starts, where it ends. That's the soft tissue. Then you go to the, let's say, you can go to the cartilage, the external part. Now you said the soft tissues, you go to the external part. You say thyroid cartilage, cricoid cartilage, arytenoid cartilage, crico, cuneiform cartilage, corniculate cartilage, right? And then you can talk about um, the muscles that exist, extrinsic and intrinsic. Extrinsic, you already know them, suprahyoid, infrahyoid. Intrinsic muscles, you can talk about so many of them that we talked about, like cricothyroid. Um, then we talked about cricoarytenoid. Then we talked about transverse arytenoids and oblique arytenoids. Then the posterior um, one and the lateral one. And all of them we know where they attach, what the function is, what the innervation is, right? Then we talked about the folds. You have two types of folds, the true vocal cords and the false vocal cords. And the true ones are the true vocal cords lining the rima glottis, and they're found inferiorly, and around them lies the vocalis muscle. They're made up of non-keratinized stratified squamous epithelium. Above them is the vestibular folds, which are the false ones. Um, and that way, when you have all of that in one place and you repeat it a couple of times, you would know exactly what you should be saying. So, before this ends, if you have any questions, can you let me know, please? No, just see. Mm,
I will watch your video about it like 3 or more times because for me it's really hard to understand. Maybe because of I'm tired a little
yes.
and
It's actually a tough structure. I'm telling you, like to dissect the larynx, very tough. But take it bit by bit. Don't dive directly into everything. Okay. And as you study it, please text me. Um, I'm sorry I am late, so hence um I will leave you guys today. But as I said, there was always gonna be like a free hour for you. We can take it anytime to just make up those things that we missed sometimes. Um, but I know I don't wanna bug you more. So just sleep today with this and ask me if you have any questions, and maybe enjoy your day today, okay? Mhm. Mm.
Thank you so much for the lesson.
You're
yeah.
very